Hello everyone, it's Dr. Joel Town here. Today I'm going to talk about some themes which are going to come up in this month's edition of the Transforming Resistance course that we're doing together. So, a couple of specific themes we're going to chat about. The first is going to be about between session behavior or activity that the client is exhibiting, is talking about, is telling us about. The things they get up to between our sessions. And how can we potentially use information they share with us about what happens between sessions as part of the treatment course? So the client comes in session four, and what you're going to see here is that the client comes in wanting to share that following on from our last session, they'd been thinking very specifically about what we've been talking about. So this is a great sign. This in itself suggests that we have to some degree a shared task. The client is orientated to what we're thinking about, and they see it as relevant enough to elaborate on in their own time after our session. So specifically what this client starts to tell us about is that they'd had a new memory had actually arisen about childhood, about their relationship with their father, and the realization that they actually had some feelings towards their father which they hadn't really seen or understood in this regard previously. So how do we use this information when the client brings this off the bat at the start of the session? Is it useful? Is there something meaningful here that we'd want to follow this thread and explore it together? Well, traditionally, and the same would apply here, presumably, in ISTDP, we're going to think about the dynamic meaning of what they're bringing forth and the dynamic factors that we can see are manifesting in the session when they bring this content forward. So, what we mean by that then is, first of all, we can think about the dynamic content. Is there something about what they're bringing here that follows a formulation or a theme or a thread that you've been talking about? In this case, potentially conflicted feelings with the father is just a very obvious, broad theme we've been exploring. So we're probably going to be interested in that. Next, as per all sessions and most of our process in ISTDP, we're going to be thinking about what dynamic parameters are actually manifesting. So we can look to what degree are feelings mobilized in the session in that moment when the client is actually starting to bring forth this material. Are we seeing unconscious anxiety related to the fact that they're beginning to explore a topic, potentially with feelings attached to it? If they are showing unconscious anxiety, what's the format of that anxiety? What does that tell us about when the person approaches this potential area of conflict, their capacity to actually start to explore the topic and potential feelings around? If we are seeing unconscious anxiety indicative of somebody having poor anxiety tolerance, so perhaps that what we're actually seeing is some smooth muscle anxiety manifesting as they're describing this topic, or perhaps we're seeing cognitive perceptual disruption, difficulty organizing their thoughts, difficulty seeing clearly with visual blurring, which all might indicate poor anxiety tolerance. If we're seeing those, how quickly do they reach this threshold? How quickly does the anxiety start to settle? Also, to what extent are we seeing or are we not seeing manifestations of unconscious defense as they start to bring forth a topic and open up around it? And depending upon what the presence of unconscious defense, what type of defenses, and to what degree is the person orientated towards this being something which is defensive and unhelpful and potentially getting in the way of both the in-session task and being more broadly problematic in the life. So then we can use these broad five dynamic parameters to start to think about what does this tell us about what we might and where we might focus in on with this client. So in this case, we see quite quickly that as the client starts to elaborate on this topic, their voice is getting stronger. We're seeing mobilization in the arms. They're owning feelings of anger. And this mobilization in the arms seems to be consistent with an angry impulse beginning to actually emerge. They're being very open with this. So we could look at this and saying, to what extent here is there some access already to previously unconscious memories? The client's telling us that these are memories which they haven't had before, they haven't thought about. They've had a realization, so new insight, again, potentially indicating to some degree an unlocking of the unconscious perhaps here. So if we think about it this way, um, we can start to look closely and look for manifestations of anxiety. We're seeing little defense. We'll start to actually see in the tape striated tension emerging, again, which would be indicative of this is a relevant topic. The person has capacity to look at it. Likely they're already openly looking at it and defenses are fairly low. So you can probably follow through the thinking here that we would see this as relevant and something we can keep encouraging the person to look at, and likely meaningful material is going to come. So in this sense, are between session activities important and can we use them? It seems in this example, definitely. The information the client's bringing fits with a dynamic theme that we've been looking at. They're bringing forth content, feelings, they have conflict about it, and they have new material they want to open up about. So we're going to explore that. If we think then more broadly about between session activities, from the more behavioral or cognitive behavioral traditions, these therapies much more explicitly think about between session activities as very important and ones that the therapist is actively going to guide the patient towards thinking about what they do and even guiding them towards what they do in the terms of in the form of homework. So the behavioral and cognitive behavioral therapies will very commonly agree on homework, what the client will actually do between sessions as a way of them practicing the content and the skills and the principles um, that are seen as important to help them make changes in their life. In contrast, though, traditionally in psychodynamic orientated therapies, the between session activities and the degree to which the therapist advises or points towards a client doing specific things is much more implicit. Typically, you won't see a dynamic therapist very overtly agreeing homework. Not to say it doesn't happen, but it's much more implicit. However, what we're seeing here is that as part of a psychodynamic process, an ISTDP treatment session, when the process is going reasonably well and you're orientated towards a dynamic task, having a formulation around what you're looking at, helping the person look at feelings, anxieties, and defenses around emotional conflicts, naturally, people start to look at what you're looking at between sessions anyway. And we can work with that. And that can be great, great material to look at. So the second theme which we're going to discuss and shows up particularly in session 4, but also session 5 of the treatment block that we're going to look at is how do we start to differentiate between the unconscious therapeutic alliance and what manifests as primarily resistance or defenses which can show up in the treatment room and form some degree of barrier or smokescreen between ourselves and our client working together on the therapeutic task. So, what do we mean by the unconscious therapeutic alliance? And many of you will be already familiar with that, but let's just remind ourselves. So, we can broadly think about the unconscious therapeutic alliance, or the UTA for short, as meaningful communications which come from the patient about their psychodynamics, which specifically start to shed some light on the therapeutic task or the things in their life that they want to change that you're focusing on in session. Why do we call it unconscious therapeutic alliance? Well, the unconscious element is because the communications specifically refer to information that can be readily mapped onto the triangle of conflict and the triangle of person. So unconscious psychodynamic factors, unconscious feelings, unconscious anxiety, unconscious defense on the triangle of conflict. and how this manifests and transfers over between past relationships, current relationships, and the transference relationships. So when we see these communications from the client where they're going beyond what ordinarily they would attend to, they're going beyond what they would ordinarily think about in their day-to-day life to bring information about more implicit variables, we can start to wonder, are these communications from the unconscious therapeutic alliance that we want to listen to? And the unconscious therapeutic alliance differentiates from the conscious therapeutic alliance, where the conscious therapeutic alliance is much more focused on the conscious task agreement that the two of you have. Also, the conscious element of the bond between the therapist and the patient, the degree to which the therapist feels heard and feels as though they have an empathic, supportive therapist, and also the degree to which the client sees the therapist as someone who is competent and likely able to help them. So the concept of the conscious therapeutic alliance and the unconscious therapeutic alliance are somewhat different, even if they're overlapping. So let's now think a little bit about how this manifested in session 4 with the client. So what we're going to see is the client comes in, as we've already discussed, and they overtly bring a new memory from childhood. And they start to talk about this memory around how their father treated them. And they start to own hatred and then anger, displaying manifestations of anger in their body, in their voice, as they're talking in the room. Then they start to say, most of the time, I don't even realize that I have these feelings. I don't even realize that these things have happened in my life. Well, that in itself, how important and curious we would be that the person can have that ability for introspection to say, these things which I'm bringing to you, I don't normally look at these. Is that telling us that this isn't important? I never normally look at it. Therefore, what I'm bringing you is irrelevant and perhaps just another smokescreen, just another lane that I'm going to take you down, which potentially won't help me or help you understand me? Or is this a whisper? Is this a communication, a subtle whisper that actually this is centrally important and the person normally avoids this? Well, this can be really confusing as a clinical scenario for us as therapists, because the dominant discourse, arguably, in psychotherapeutic fields has been the value of the conscious therapeutic alliance and the discourse that the predominant evidence we have in terms of understanding the ingredients of change, what makes psychotherapy effective, is that the conscious therapeutic alliance is the best evidenced ingredient that we can actually look at. So when a client's words might point to the fact that this isn't important, maybe we shouldn't look at this. I don't normally think about this. So why should we think about it now? When we hear that, we might question, is the person actually interested in this? Do I need to follow what they're saying? Likewise, if a client brings up information and they start negating uh, the relevance of what they're actually saying. So in this case, the client comes in and they start to talk about this anger and a hatred towards their father. And we start to actually ask them about those feelings. You'll see me asking the client, so you have anger inside of you. Could we look at this anger? The client starts to say, well, it isn't a lot of anger in there, really. So if we listen to these words, on one hand, they're manifesting anger, manifesting about past experiences with their father. On the other hand, they're questioning, actually, there isn't a lot of anger coming up. If we listen to the words alone, could we hear a conscious alliance telling us, this isn't important, don't listen to this? and we could follow that. On the other hand, if we actually begin to see this as unconscious therapeutic alliance and the person telling us what is important, telling us that they have a lot of anger in there that they normally avoid and they don't normally think about, through their words saying there isn't very much in there. In a way, this is one communication from the unconscious therapeutic alliance that we want to listen to. So let's look at another example of patient communication and how we interpret what they say, potentially on this spectrum of unconscious therapeutic alliance to possible resistance. So the clients already come in and they're talking about this revelation around realizing this anger towards their parent about specific memories from childhood, how they were treated. As they're doing so, you can see anger showing up in their body. So you'll see me actually orientate them to that. Is there anger rising in your body? How do you experience that? They're able to describe rising feelings of anger inside their body. So then I orientate them to say, so who is this anger towards? Asking for specificity so we can clearly keep the father in mind. The patient then says, still, I don't want to put this towards someone. So what do we make of that? Is this the client telling us that this isn't important, this feeling doesn't need to be looked at, and therefore we should listen to that? Or is this a whisper from the unconscious therapeutic alliance telling us that, in fact, they do have these feelings to a specific person, the father, and they want to look at it? So if we see it as the latter, you'll see me ask, you mean this is towards your father? Well, I guess it's the memory of him that triggers the anger inside of me. So clearly, then they own that, and the process can start to elaborate further. Within the next 20 seconds, you invite them then to look at the strength of this anger. The patient's words or response are, the best I can do is, the words might imply they're not able to look at these feelings, that there's a resistance dominant, that they're perhaps taking a helpless stance towards their own emotions. Or we could take the words as that the best they can do, there's a lot more they can actually do, but they're negating the fact that they could do much more. So if you see it as the latter, and you'll see me saying, so where has the impulse gone inside of you then? The patient's response was immediately, then they say, I don't know where it's gone. We could view this as more resistance, more helplessness of the client stepping away from owning the fact that they clearly have access to anger. They just don't want to explore it. Or we could review this and consider this more unconscious therapeutic alliance. They know exactly where it is. If we view it as the latter, we can say, it's still in your arms, question mark. Patient's response to this, yes, it's clearly here. They own it. They own it. It was a thin disguise, but they're also pointing to just ask me more about it. And then they follow up by saying, but maybe with time it'll go away. Again, they're whispering here potentially to either the fact they'd rather it just go away or that I could do something about it. Let's look at another example around what happens in the next couple of minutes. So again, more and more examples of what we can think about as negation. The client telling us how they do feel by actually telling us that they don't feel a certain way. And repeated examples of this in the setting of continued mobilization of mixed feelings inside their body, continued orientation to having feelings towards people, alongside striated tension and evident conflict, wanting to look at the feelings but not looking at the feelings. Put this picture together and you can start to say, this sounds much more like unconscious therapeutic alliance than resistance. Let's just follow this course and good things are likely going to happen. Another couple of examples which again can speak to the mystery behind the unconscious element to patients' communications. A little bit later on in session 4, as we're further encouraging the patient to own the degree to which they have this anger towards their father, but they're still hovering around further exploring. The client starts to get more animated, more anger rises up inside of their body. They again describe another rise in strong anger associated to further memories around childhood. Then the patient says, as I'm picturing my impulse, as I'm picturing myself hit my father, I picture softened hits. So what is the communication here? They're telling us in the process of exploring a violent impulse that the impulse is actually being softened. Well, this could be resistance. This could be a marker of the fact that they're wanting to hold back, defend against fully experiencing the impulse. On the other hand, perhaps there's some meaning behind softening the hits. In the context of everything that's come before, i.e., the person seems consistently with a lot of unconscious therapeutic alliance mobilized, they're exploring feelings, they're just slowly unfolding this. We could see it perhaps as some alliance around. Let's not overread potential resistance. In the next 2 minutes, the client ends up then describing how they have a memory of when their father was hitting them as a child. They detected that the father softened his hits towards them. So actually, when we take this in on board, the client holding back aggressiveness towards the father seems to be intricately related to the fact that the father also held back the degree of aggression towards the son. 3 minutes later, the client then offers, is it possible that deep down in my heart, I know he didn't want to hurt me, but anger comes because he did hurt me? Again, when we step back and see the gestalt here, you can start to see potentially that the former two sentences are not manifestations of resistance, but actually likely really nice markers of a strong unconscious therapeutic alliance. And with continued focus to explore this, the client's then able to make this profound statement. And not just a possibility, but they're sharing with us their understanding of the psychodynamics behind why it's so hard for them to own aggression towards their own father because of the recognition that the father actually had care and withheld aggression towards them. So, what can we take away from the discussion around distinguishing manifestations of unconscious therapeutic alliance and potential manifestations of resistance? Well, taken out of context, any words alone can either sound like unconscious therapeutic alliance or they can sound like resistance. The best we can, let's zoom back so we don't lose the forest for the trees and think about the context of what's being said, how it's being said in terms of our parameters, our dynamic parameters that we understand. So that's all for today. I'll see you next time and bye for now.